Ms Traynor.
Good morning.
Lara, good morning.
Good morning.
Yes, when you're ready, Ms Traynor.
Thank you. Good morning. I wonder if you could begin by stating your full name.
Yes, my name is Martin Crewe and I'm the Director of Barnardo, Scotland.
Thank you, Mr Crewe. And for the purposes of today, you have provided a statement to the inquiry, I think some time ago,
yeah.
in August of last year, and you also provided some supporting documentation. For our benefit, the reference for that statement is SCI WT 0429 5 zeros and then a number 1. You should understand, for the purposes of today, that all of that information will form part of the evidence that the inquiry will consider. I wonder if I could start by asking you how long you've been in your current role.
I've been 17 years as Director.
Barnardo's might be familiar to many of us, but are you able to give us an overview as to the objective of the organisation?
Yeah, so Barnardo's is a large UK social care charity, and we operate across all 4 nations of the UK, basically working with disadvantage for children and young people roughly aged 0 to 25, covering just about every aspect of disadvantage.
And in terms of fulfilling that objective, what services do you provide? What range of services?
We provide well over 100 services across Scotland, residential care, youth justice, substance misuse, children leaving care, children with disabilities, just about everything.
Do you also provide things like fostering and adoption support?
Yes, we also provide fostering and adoption support and employment support.
Employment support for children and young people?
Yeah.
And it might be obvious, but are you able to give us an overview about the range of the service users that you fulfil?
Yeah, so as I said, the age range is sort of 0 to 25. Some of our services at the upper end of that haven't got a hard cut-off at 25, so you know we'll still support young people as long as they need it. But basically, it's children and young people who need support, whatever that looks like, and that extends to very much sort of family support as well.
Can I take it from what you're saying that part of that role then also is supporting potential carers for those children as well as the children themselves?
Yes, very much so.
Your statement highlights a number of aspects of the service which were impacted by the pandemic and which I wanted to explore further with you. But before perhaps we discuss the specific services that you highlight, you say generally, I think, that the main short-term effect when you were told that the country was going into lockdown in March 2020 was effectively you had to make pragmatic decisions about what can we keep doing and what must we stop doing. Can you tell me a little bit about that process?
Yeah, I mean, I think going back to March 2020, you know, things were happening very quickly. As well as the social care work Barnardo's does, we also have a substantial range, set of charity shops with around 80 shops in Scotland alone and 700 across the UK. Those had to close immediately as part of the lockdown, and obviously that had a big impact on our income and what we were able to do. On the service side, it was really working out what we could still do safely and not let down the children, young people and families who we were supporting. And the certain parts of the system just had to stop, and it was, you know, it's very hard on a lot of the particularly the young people we were supporting, you know, to suddenly have to be very isolated and you know, not know where the support was coming from.
You then, I think, go on to discuss that the organisation was seeing families who had immediate needs. and the pressure at that time for some people that you were working with was quite extreme, I think you say. Are you able to tell us about those needs that you were seeing immediately?
Yeah, I think, again, going back to that time, because the economic impact was so sudden, a lot of companies took very immediate decisions about what to do with the workforce. And some companies were brilliant about that, but some made people redundant straight away. And I think it's important to remember that although the furlough scheme came in, that there was quite a gap between those initial decisions. So some of the families we were working with, who were getting by, suddenly had lost all their income, and they weren't signed on to benefits or anything. So that sudden impact was extreme for some of the families we were working with.
You also give a sense throughout your statement that it's important to have flexible support.
Yeah.
And you as an organisation were able to provide that quite quickly. Can you explain what you mean by that?
Yeah, I think you can have all the plans in the world, but once this happened, those went out the window. And the important thing was that we responded really quickly, and I think getting help direct to families who needed it, who'd simply run out of money, was really important. So we were as flexible as possible with Barnardo's resources, but also early on we lobbied the Scottish Government to say, look, we can get money out the door if you trust us and allow us to allocate this money to families. We will do it responsibly.
That leads me on, I think, to ask about the various funds that you raise within your statement. And I think there are 3 funds which you mentioned specifically. Yeah. The first is a fund which is termed the Immediate Priorities Fund. Can you tell me a bit about that and the application of it? Yeah,
so when COVID first hit, as I say, the impact was very immediate, and we worked closely with Action for Children, which is another big children's charity, and basically we approached government and said, look, if you could allocate some money, we can get it out the door. We won't charge anything for that. We will simply distribute the money. And we went to them and said, can you give us a reasonable amount of money to distribute on that basis? So that was the first allocation, and for Barnardo's it was £448,000, which was basically March till June in 2020, and that was very much that immediate support.
And you say, I think, that in your view, communicated a really positive message to your service users, that you were able to go out and say, if you see something, a family that needs something, then you're able to just respond to that. I wonder how that's different to what you were doing before.
The process before was wherever possible, if a family was in difficulties, you would try and direct them to a source of funding that might be able to help, and it varies across different local authorities. And although we would be a safety net as in the end on that process, it was more based on there's systems and there's processes to help you. I think during COVID the problem was that a lot of those systems just seized up, and people just needed very immediate support. And I think it's important to say this wasn't just our Barnardo's workers. We've also worked in partnership, particularly with like schools. And if a head teacher said to us, we know this family is struggling, we're finding it difficult through the local authority to access support quickly, can you help? basically, if it was a trusted partner, we would help with that as well. And I think the other important thing to say is that we had our financial systems in order. We've got a terrific finance team who are very can-do about how can you actually get money out in a safe and secure way to the families who really need it.
Are you able to give us a flavour or a general idea about the immediate needs that you were seeing very early on?
I mean, I got one example which I can mention if you like. There was a young person who was a new mum, so sort of a teenager who, and she had a baby who was under 1 year old, and she was very anxious during COVID. A lot of people were, of course, and she found it really anxiety-provoking to go to a supermarket. And what we did was we allowed, we gave her a bit more money to do her shopping, and what she did then was shop locally in smaller stores, which she found less stressful, and she could actually cope with shopping for her and her baby then, which the thought of going to a big supermarket, which might be slightly cheaper, but was just so anxiety-provoking that she couldn't do that. So I think there's some kind of non-obvious benefits of how we use the Wellbeing Fund, but most of, particularly in the early days, one of the big things was technology, because when the schools closed, a lot of kids didn't have access to their own tablet or computer, and their living conditions, they're often sort of sharing very close quarters, and so gearing up the technology side of it was quite important as well.
Can I take it from that you were able to provide funds to assist with purchasing those items?
Yeah, I mean, there were national shortages of some tech as well, and we had a partnership with Vodafone at the time, which was really helpful in terms of actually accessing kit as well.
You then go on to discuss another one of the discrete funds which you set up. I think the Immediate Priorities Fund was as it's termed, immediate, straight after the lockdown period in 2020. But then there was a winter support fund both in 20 into 21 and 21 into 22. Can you tell us what that was utilised for? Obviously the COVID period, the dynamics changed sort of from the immediate sort of lockdown through the summer, which was very difficult for a lot of people, into the autumn. And I think what we and others realised was that the winter was going to be a really hard time for people. So again, we spoke to the Scottish Government and said, look, can we, to some extent, you've been very helpful on the immediate priorities, but we're anticipating, particularly on the food side, a big impact over winter. And what they said to us was, well, how much do you think you need? And so on that basis, we were able to go, as you say, it operated both winter 2020/21 and the following year. And over the 2 years, our total distribution on behalf of the Scottish Government was 645,000, and we added Barnardo's money to that. And so together with the Immediate Priorities Fund, we distributed well over £1 million direct to children, young people, and, well, mostly families. The last fund which you narrate within your statement is something which is termed the Summer Wellbeing Recovery Fund of 2021. Again, can you tell me about that? Yeah,
I mean, I think that was a lovely thing because, again, if you cast your mind back, how hard it had been, because people did people did work with the immediate priorities and the impact, and loads of people, not just Barnardo's, really stepped up. But by the summer of 2021, you know, a lot of families hadn't had a break, and again, you know, what we were able to do was talk to the government about, you know, a relatively small amount of money could make a big difference for some of these families. Again, you know, we were granted funding, so we had 274,000 of money for the sort of get into summer programs, and the feedback from the families was fantastic.
And are these programs where children and young people are able to spend some time out with family and out with the home and do some safe activities in the summertime? Yeah,
I mean, a lot of it was going to the beach, going into areas of natural beauty. We worked across 24 local authority areas across Scotland, and just basically did lots of fun stuff. And I think, because of what people have been through with COVID, rediscovering that fun element with families just made a huge difference.
I wanted to move on to discuss the impact that you as an organisation saw on the children and young people and also the families that you're serving. And you say in your statement, I think, that you were engaged quite closely with the community secretary in relation to communicating that impact and having a dialogue about it. And I wonder, what type of things were you reporting that you were seeing?
Yeah, I mean, one of the other things that I would say to the Scottish Government's credit was that when they were allocating these funds out to us, there was a lot of trust, and we weren't required to do heavy monitoring and reporting back. So the reports that we produced for Scottish Government were actually full of quotes and things from young people themselves, from families, and so yes, it was anecdotal, but it captured some of the actual spirit of what had happened, rather than, you know, just the figures and, you know, being due diligence. You know, one of the reasons that I was keen that Barnardo's gave evidence to the COVID inquiry was that I think we did some brilliant work over that period. It was a horrible period, but what we did, how we engaged with families, I think, you know, really made a difference to a lot of people.
And at the time where you had a dialogue with the Scottish Government, were you able to report what you were seeing, and what were you reporting that you were seeing in these families?
I think we were, one of the things that was really helpful was that we were able to report things very quickly, in terms of, as I say, you know, that first round of redundancies, when we went into the first lockdown, was very sudden, was very big impact, and I think we were able to communicate some of that. I think the differential impact on different groups was really important as well. So some of the young people we work with can be sort of quite chaotic in their lifestyle. So having all of the COVID rules and sticking to them was a real challenge. And you know, so how do you make a system that, you know, still upholds children and young people's rights, but allows everybody to be safe? And, you know, I have to say, my experience with ministers, we work particularly closely with Aileen Campbell, but also others. I think people were genuinely trying to get it right. You know, it was difficult, it was changing every day, but we were working hard to do that. And as I say, you know, I think being a sort of frontline organisation, being able to say to ministers, you know, that this is what's happening on the ground, I think was very helpful to them.
You mentioned there about some of the young people that you serve being quite chaotic.
Yeah.
in their lives. You mentioned, I think, in your statement that your observation was that perhaps looked after children and young people particularly were disproportionately affected by things like fines and policing of lockdown regulations. I wonder if you can tell me a little bit about that.
Yeah, I mean, one of the things we did early on was produce a whole series of reports on a weekly basis of what we were doing to respond to COVID, and we called these reports In This Together, and over sorry, just check get the period right. So between April and July 2020, we produced 10 of these reports actually describing what it was we were doing. Quite a lot of those referred back to how we were using the government funds to support families. And I think one of the really important ones we did was around children's rights and, as I say, getting that balance between safety but still upholding children's rights, because a lot of the systems, children's hearing system, a lot of the systems that allow children to progress from care, you know, basically stopped for a period, and that had a big impact. And as you say, I think one of the areas we were particularly concerned about for young people was the fixed penalty notices, and that was very unevenly enforced across Scotland, and you know, some of our young people, you know, were served with fixed penalty notices, which we felt was harsh.
You, I think, observed that the pandemic meant that a lot of things moved online naturally, and your view, as you say in your statement, was that perhaps there was an assumption that children and young people would deal quite well with that because they're typically online, but in your experience it wasn't that straightforward. I wonder if you can tell me more about that.
Yeah, I think one of the themes through all of this is, you know, it's been said many times, you know, we were all in the same storm, but we were in very different boats, and I just think that is very true. You know, for some families, you know, they actually coped quite well with the restrictions and the lockdowns and things. Other families found it extremely difficult, and their circumstances were really difficult. And children and young people are all different. You know, so sometimes actually being able to do online support in the evening suited families better than coming, you know, than what they had previously of coming somewhere during the day. But you have to be really flexible, and obviously if you're working online and you're trying to pick up not just the straightforward sort of interaction, but what's going on below it, how does the family feel together? You know, if you're doing a home visit, what's the environment like? All of those things are lost when you're working in two dimensions.
In your statement, you discussed something which was called the Wee Hub that you set up.
Yeah.
I wonder if you can tell me what was that for and what impact did it have?
Yeah. So going back to my theme about, you know, flexible support, one of the things we looked at straight away was what Barnardo's resources are there that we could use in whatever way, and we've got an office in Oxgangs in Edinburgh, and that was used as both a sort of administrative office, but we also had some services there. And obviously during lockdown, the number of people who could work from anywhere was heavily restricted. And what we did was repurposed the whole building to say, okay, well, there are some families who are finding it difficult to access services for various reasons, and we set up the Wee Hub in that environment to work with, you know, a number of families who were kind of falling through the cracks. So we worked with the local authority to try and identify those families who they were finding it most difficult to give support to. And as I say, you know, we set it up, and it was often around people with other caring responsibilities, or if they were key workers, how do their children get support? And you know, the feedback we got on that was fantastic.
And when you say perhaps families who were falling through the cracks or between services, what sort of issues were they having at that time?
Well, so, some of it was about loss of routine. So it was very difficult to keep all the balls in the air. And I think I can remember one of the things with my staff team was people's caring responsibilities were so different, and everybody was affected differently, and that during lockdown, you know, how you coped with that, where your family was at in terms of your children's age and stage and what their needs were. So there wasn't one pattern, but the WE Hub gave an opportunity for a break. So you know, the families could drop off the children into a COVID-safe environment. Do activities. We got an outdoor space in Oxgangs, so they could come and do some fun things and actually, you know, give the parents a bit of a break.
I'm curious, did you find during the pandemic that the organisation was serving users who perhaps would never have been referred to the service before?
Yeah, and I think this was one of the. It's hard to sort of capture the essence of it now, but one of the things that was so good was how we worked with local authority colleagues, with other charities, to say, how can we make sure that no family falls through the net? And it almost doesn't matter who picks them up, but let's make sure, you know, if somebody doesn't fit into one service, that there's something else for them. And I think to some extent, you know, the WE Hub was at that sort of the bottom of the net. So if people didn't fit into something else for whatever reason, you know, if the family was really anxious about child going back to school or whatever, you know, we could provide that support.
Did a lot of the services you're describing require the family to come to you rather than you coming to the family, or how did the referral system work?
I think what I'd say was it was multi-channel. So you know, there's a phrase, no wrong door. So if the family came to us direct, we would try and respond. If the family came via the local authority or via a head teacher, I think there was that spirit at the time of how can we respond best to families, whoever, and we tried to make sure that if they came to us, that they got a response, and if you know, if there was somebody else who could do it better than us, fine, but you know, that the principle was that no family went away without the support they needed.
You think I used the term kind of safety net or dropping through the system, and I wondered if you as an organisation felt any safeguarding implications or child protection considerations in relation to the service users that you perhaps didn't before? Yeah,
I mean, there were some positives, but you know, we've also got to remember that for some families, particularly during the lockdown period, you know, if you've got the family all together in a small space with very, very limited activities and often pressure of finance, etc. Not surprisingly, in some cases, you know, domestic abuse increased, and a lot of the the normal checks and balances, particularly when the schools were closed. You didn't have eyes on the child in the same way that you would have done under normal circumstances. So yes, we did have safeguarding concerns, but I think there were also examples where it went the other way, and children paradoxically were safer. I mean, I can mention an example if you like. So we have some specialist child sexual abuse services, and during lockdown, one of them was aware of a 13-year-old girl who was going missing from her family on a frequent basis, and she was actually sort of staying with a 17-year-old male who was sexually exploiting her, and police and social work had tried to make some changes, but she kept on running back to him. And what happened during lockdown was that she was then stuck with her family. So she then spent more time in the care of her parents, and what happened was that she was able to make that break with the young man who was exploiting her, and because of that enforced period of having to work, having to be at home, she disclosed to her mum and dad that she'd been sexually assaulted, and they responded with care and love. And what happened was very positive, that she renewed her connection with her parents and managed to break out of an abusive relationship. So, COVID was mixed in its impact, and I'm not saying that that everything was good about those sort of lockdown arrangements, but there are examples like that which enabled children to break out of abusive relationships.
Perhaps you're describing a situation where the external difficulties and negative influences might go away, but if there's internal within the home, then those might increase.
Yeah.
You say generally, I think, in your statement that child sexual abuse and child exploitation risks certainly increased during the pandemic. Can you explain a bit about that? Yeah,
I mean, for simplicity, if we're talking about exploitation, it tends to be sort of outside the family. So, those opportunities might have somewhat decreased in some ways, but within families the stresses were higher, people were on top of each other, and so the risks of abuse within families unfortunately increased. But it's also quite a complex mix, because particularly around exploitation, there's a relationship with drugs often, and one of the impacts of all the lockdown activity was that a lot of drug supply units became more problematic. So in some places there were less drugs in the system, which kind of helped as well. So there were all sorts of complex dynamics going on at the time.
Are there any meaningful statistics available in relation to the increase in child sexual abuse during the pandemic?
I haven't seen any. So
thank you.
It might be possible to assess those now. It takes some time for the stats to come through.
See that? Yeah. Thank you. We might think about that.
You also discuss, I think, one of the potential issues, or an issue that you saw or the service saw, being rural isolation, particularly with rural families, but also rural foster placements or care placements. Can you tell me a little bit about that? Yeah, so
obviously travel became more problematic during the various lockdowns, and I think the young people we work with are often in sort of quite isolated areas. If you're quite a lot of our foster carers are rural-based, and just getting out and doing other activities, college activities and things were disrupted. So I think it was just a general impact.
You also discuss, I think, children and young people spending more time online, and that coming with perhaps a safety risk to them that maybe wasn't focused on as much because of the immediate need. Can you tell me what the service saw about that?
Yeah, I think again, one of the things that happened for some families was a bit of a loss of structure during lockdowns as well, particularly when the schools were closed. The sort of the playing games into the night became more common, and one of the things we're very aware of is the opportunities for exploitation online, not just through sort of chats and things, but also related to gaming and things like that. So potentially the risks to children were increased. Going back to your earlier point, I think we would struggle to find stats on that, but I think what I'd say is that risks during this period moved in different ways for different families, and some of the impacts were kind of non-obvious at the time, but were picked up later.
I'll take the opportunity, but are there any other risks which were non-obvious at the time that you can immediately think of as now having come to light?
It's just, I think it was in the evidence we provided. There was we did a summary of the impacts on different aspects of the UN Convention on the Rights of the Child, and so I think we in very brief detail we pulled out impacts on education, on the views of children. I think that was one of the things which was quite difficult to get right at the time, because the processes were geared to how do we keep each other safe. The decision making which we might have wanted children and young people to be involved in, realistically a lot of those decisions were made by adults without any reference to children and young people's preferences. And I think some of the decisions about putting things online, for instance, it made a lot of sense for adults, and it kept some systems running, but actually for some young people they found that extremely difficult, whether they didn't have the tech or didn't have the ability to engage with that. So a lot of decisions were made for the right reasons pragmatically, but I think the impact was sometimes a bit disempowering for children and young people. Things were happening to them. There was a lot of heightened anxiety. All of the communications were about risk and keeping safe and everything. And of course that impacted on all of us, but it impacts particularly on children.
When you talk about children's views, in what context are you talking about decisions being made for them? Is it children's hearings or things like that?
I mean, children's hearings was probably one of the most obvious areas where, in an ideal world, decisions on the changes made to processes should have been, engaged and got views on, and not surprisingly, decisions had to be made very quickly about what was feasible and what wasn't. But that's not the only area of activity. I think quite a few bits of the children's system, if you like, became significantly more difficult. So, if you're assessing foster carers, for instance, that was impacted. If young people were planning to leave residential care, that was impacted. If people were in temporary flats, which might not have been kitted out because they're only intended to be there for a couple of nights, suddenly they were there for weeks. You know, just those, because particularly the first lockdown happened so suddenly, all of the system was impacted, and in an ideal world we'd have planned for that, and you know, we could have said, oh well, on balance it would be better to do this or that. Everybody was making instant decisions.
Those processes that you just discussed, are those typically processes which prior to the pandemic would involve a discussion with the child to get their views? Yeah,
and I think, to be honest, we're usually quite good at that. You know, we try and take children's views into account, and you know, in the better processes, you know, it's a rights-based approach to say children have a right to have a say about how they leave care, for instance. You know, what's going to be good for them, give them an opportunity to try something out, to see if it's going to work. It's a very big step, you know.
And that essentially was a process which perhaps you said decisions were being made about them rather than involving them. Yeah,
and I think to some, I come back to my point, it's very difficult to get the balance right, because the situation demanded quick decision making, and I think I was reviewing how we operated during this period, and it was just so incredibly fast moving. I would have a meeting with my team at 8:30 every morning to plan what we were going to do, and communicated out to all staff in the afternoon every day, because literally things were changing day by day in terms of guidance on all the social distancing, in terms of how we access PPE for some of our services, what was allowed and what wasn't. You know, there were just so many confusing messages at the time that I think you know, we the danger, I think, for reviewing everything now is to take a very logical lens on it and say, oh, you know, well, on balance, we should have done more of this or that. You know, things were changing day by day.
In terms of the changing messages, did your organisation feel like you had a role or a duty to assist in communicating that to the children and young people that you were involved with?
Yeah, I think we did our best. I mean, the way Barnardo's operates is through through over 100 fairly discrete services. So what was right for one service wasn't right for another. But I think one of the things which I learned in terms of how do you manage in this sort of situation is you have to let go. You know, to some extent, your instinct is to try and pull decision making in to a sort of central point, but actually that's the opposite of what you should do. You know, you've got to trust people to make the right decisions, and we actually loosened the purse strings on things. So if people identified that they needed to do something, not just for a family, but if there was things that they needed at a service level, I tried to just make it as easy as possible for people to do the right thing.
I think you say in your statement that in reflecting on that process, your experience was that when people are in those kind of times of crisis, actually they don't take advantage and they don't flood the system. I wonder if you can tell me more about that.
Yeah, I think we can be a bit sort of over-cautious about setting up systems to avoid them being exploited. And our experience, I have to say, you know, generally, but also during COVID, is that the vast majority of families are not trying to exploit the system. And if you have too many checks and balances, you actually inhibit what you're trying to achieve. You know, families often have to clear so many hurdles to get support. It's really our job to help them access money and support rather than to put in place processes to hinder them.
Can I ask a cheeky question? have you gone back to the old ways since the pandemic has receded?
Oh, well, that's a very good question. And unfortunately, to some extent, yes, we have.
I didn't mean that in an imperfect way, but it's interesting, isn't it?
Yeah. And I think some of us, particularly in the sort of charity world, have said, how can we capture that spirit? Because for all the awfulness of COVID, that spirit of how can we help people just really, not just from charities, but I think there was a community spirit, and it's a real shame if we lose that again.
Thank you for your candour.
You mentioned the children's rights aspect of your role as an organisation, and in particular, I wanted to explore that in relation to looked after children and young people, which your service has experience of. You mentioned, I think specifically in your statement, a briefing that you put together in March of 2020 seeking assurances from the Scottish Government. Can you explain a bit about that briefing and why you felt it was necessary at the time?
Yeah, I think again, it goes back to this point about how do you get the balance right. So as children's rights are hard won, and what we were trying to communicate to government was, yes, you're making these pragmatic decisions, but can you also think carefully about the decisions you're making, and the looked after children, particularly those in residential care, the impact was very immediate, and organisations like ours had to decide how we were going to respond to that. And I think you're going to take evidence from one of my colleagues who was managing one of the residential units at the time, and the impact that on those young people.
You say, I think, in that briefing that you would like assurances that looked after children and care leavers would receive the same level of support, despite the fact that local authorities perhaps were relaxing in their role a little bit. In terms of the local authorities relaxing in their role, how did that manifest? Well,
I think I would preface my sort of comments on this by saying, A, they're a bit anecdotal, and B, it varied a lot. I mean, some of the local authority colleagues we worked with were magnificent and really stepped up and worked in very much the same spirit as ourselves. But I think local authorities have processes, and it took some of them a bit of time to work out how you get beyond the initial reaction is that COVID just stopped you doing stuff. So, as I already mentioned, if you were, if you at the end of March you were a young person who was planning to move out into a flat on 1st of April, suddenly that wasn't going to happen. So, how do you manage that process as well as possible, and also try and look creatively at what's still possible, rather than just saying, well, you can't move because of COVID and that's it. And I think one of the challenges always is getting different parts of the system to join up in the best interest of children and young people. And you've got a lot of moving parts. You've got the social work side of it, you've got the housing side of it, you may have other supports in place around College Place or whatever, and trying to make sure that all of that works together, keeping that young person at the centre, rather than just, housing saying, well, we can't do this,
And in putting out that message and seeking those assurances from the government, effectively, and local authorities, can I take from that you thought perhaps that looked after children and young people might be lost in everything that was going on?
Yeah.
You say within your statement it's difficult to say what the Scottish Government could have done differently, but what is yet to become clear is whether the ongoing support and recognition of the impact of lockdown on particularly young people's development is being adequately resourced or taken care of. do you have a sense of that now as to what that impact has been?
Yeah, I mean, we work with over 400 schools across Scotland, and we did a quick survey of the staff working in those schools, and the biggest immediate impact that we saw was a huge rise in children's anxiety levels, and I think that has continued. If you look at the numbers of children who disengaged from school during the pandemic and have struggled to re-engage, I think those rates have increased in terms of the number of children who are either out with school completely or are less than high attendance, not 100%, but that those who are sort of not attending all the time. And I think some of that sort of bond was broken during COVID for some of those children around, the school's there, it's where you go every day, that's what your normal life is. And I think for some kids that became a source of anxiety, and and sometimes that was related to parental anxiety as well. We have to, if you remember at the time, it was such a stressful period, and that impacts on children's mental health. And I think one of the other aspects was how it impacted the exam system. So obviously for the exams that were taking place in the summer or spring and summer of 2020, it had a very immediate impact. But for other children, there was that impact on their learning, and how could schools respond to that in a way that was supportive, but also trying to help them catch up with the learning they'd missed. So there were a lot of dynamics, I think, in schools, and to some extent they all handled it differently.
Does the organisation generally have a sense of how children and young people's mental health has been affected?
Yeah, I mean, we're very concerned that the current response on children's mental health is out of all proportion to the challenge that's there. At the moment, the Child and Adolescent Mental Health Service, CAMS, is where a lot of referrals go to because there's nowhere else. But CAMS isn't designed to deal with the volume of activity that is around now because of the mental health concerns. So if you're a parent who's concerned about your child's mental health, the reality is that it's very hard to get that support, and certainly in a timely way. So there's a lot of concentration on CAMS waiting lists, but actually, one of the issues is that even if you get to the top of the list, you may then find that your child's needs don't fit what CAMS can provide, and some of that is around are your child's needs significant enough? But paradoxically, it can also be that your child's needs are too much, because if your child is kind of in a chaotic state that they're not going to respond to the mental health support, then they may not fit the criteria either. And I think we've got to have a much more serious conversation in Scotland about how do we support the mental health of children when we know that something like a quarter of children have got mental health needs that need support.
It might be said that children's mental health was an issue before the pandemic. In your experience, is it now more significant?
Yeah, I think it was increasing before the pandemic, and the pandemic's given it a boost. So I think a lot of schools are really struggling to deal with as I say, anxiety particularly, but a lot of related mental health challenges in the mix as well.
I wonder specifically about looked after children and what is their specific needs, how they were impacted by the pandemic relative to just young people and children generally.
I think it's difficult to generalise because, you know, as you know, looked after children covers a lot of different categories, and you know, for children who are in foster care, if it's a stable placement, probably their experience was not that different to you know, to a birth family. We've already talked a bit about the impact of children in residential care, where a lot of activities and things were cut off, and I think that was, if I'm thinking about some of the young people we support, you know, sort of later teenagers, a lot of their mental health is tied up with being able to see friends and to actually sort of take part in activities that help them regulate and deal with you know, maybe mental health issues which would surface otherwise, and I think that's the concern, that you know, how if you take away those sort of supportive factors, you then sort of have more problems.
You mentioned in your statement that, in your view, the processes which were put in place that allowed young people to leave and were essential for kids to come in to the system, I think you mean, a lot of that got a bit stuck.
Yeah.
I wonder if you've got any experiences or anecdotes about that.
Yeah, I mean, I was going to say straight away, I mean, it is a bit anecdotal, and it's also kind of difficult to, you know, it's the absence of something happening. So children would, you know, if there were concerns, children would come into care, and a lot of those processes were inhibited by COVID restrictions, and so therefore the children who we might have seen come into care didn't, and so on the one hand that creates more, potentially more difficulties within the family, because if they were going to be moving out in a planned way, that would hopefully ease the stress of a situation, but in other cases we'd obviously try and support the family to maintain their child.
Towards the end of your statement, you go on to discuss lessons to be learned, and you say that in your view, we've spoken about this already a little bit, but that charities are not subject to the same constraints as statutory bodies, and so they can move quicker, they can be more flexible, and that, in your view, has been an advantageous lesson to be learned. You've already said that in some processes that's rolled back a little bit to what it previously was. Are you able to tell us, just generally, whether the systems have continued to be implemented in the same way as in the pandemic, or what has changed in terms of the organisation?
Yeah, I mean, I think probably the biggest change perhaps that's been continuing has been a shift in balance towards online activity and support, and some of that is good, because actually what we've all realised is you don't have to do everything face to face, and online can, in its right place, can be really effective. And I think one of the things we've learned, in terms of our support to families in particular, is that actually support online in an evening could be more effective than saying, well, can we meet up during the day, and making all those arrangements. So there are some positives. I think we've also stepped up the technology. I think there's a danger that we forget how clunky things were. Trying to set up a video meeting pre-pandemic was usually fraught with difficulties in my experience, and we've moved to the position where you just put out a reference on, this is the Teams link or whatever, and you just expect people to be able to access that. And so I think some of the external liaison is easier now than it was potentially, but you do, on the other hand, lose that sense of relationships and how do you work effectively with partners, and particularly if you're making difficult decisions around things like children's hearings, how do you get that to work really effectively, and get that balance right.
The last issue that I wanted to raise with you is that your statement in general terms and your evidence today has been relatively positive in relation to the impact on your organisation. And I wondered if that is truly your view and your experience.
I think, it's been quite sobering for me to sort of, reread a lot of the stuff that we produced at the time, and it already feels quite a long time ago. I think, it was an awful situation, but a lot of people really stepped up and did their absolute best under the circumstances, and that's the bit that I'm really proud of. That there's probably loads of stuff which never came to me that was just people in our services going out saying how best can we support families, and what I tried to do as director was to have systems in place that allowed them to do that. And it's a small point, but the things like the financial systems, it's the boring stuff, but you have to get it right, so that when we say to a family, yep, we'll get you a payment today, that we can actually do that, rather than say, I can see you really need the money now, I'll put in a request that we get that to you by next week. It's things like that which really make a difference. And I think we don't always need all of the checks and balances that we've put in place. Trust, the cost of that is significant, and if we had more trust in the system to say, actually, as the Scottish Government did with us during the pandemic, we trust you to distribute quite large amounts of money that come from the public purse and do good with it, that you can actually do that, and that people will respond positively to that. So yes, I think in a peculiar way it was a very positive period for us, and I think we some of the families we worked with, I think that message of we're genuinely here for you, rather than it's just another set of people who are paid to be in our lives to make it more difficult sometimes. We really tried to get alongside people and help them.
Those are all the questions that I have for you, but I wondered if there was anything which we haven't covered which you thought it was important that be raised today.
I think that feels quite comprehensive to me.
Well, thank you very much for your time.
Okay, thank you.
I'm very grateful, Mr.
Thank you.
Thank you very much indeed. Very good. We're about 10 minutes ahead of schedule. I don't know if the next witness is available, but if they are, shall we say about 5 past? If they're not, we'll just have to be a wee bit later. Thank you. Right, now, good morning again, Ms. Barima, Mr. Culley. Ms. Barima.
Thank you, my lord.
Barami, sorry.
Good morning. Your full name is Ronald James Hector Culley, is that correct?
That's correct.
And you're the CEO of Quarriers?
Yep.
You previously gave a statement to the inquiry, and for the record, the reference for the statement is SCI WTO 0441-501. Are you content for that statement to form part of your evidence along with your oral testimony today?
I am.
Thank you. Could you please tell us a bit about your own background to start?
Sure. So I've been the Chief Executive of Quarriers for the last 4 years, almost to the day. Previous to that, I spent 5 years working as the Director of the Health and Social Care Partnership in the Western Isles, and was in that post for around 5 years. And before that, I worked for the local government body, COSLA, for the best part of a decade.
Thank you. And could you tell us a bit about the background of Quarriers and the range of activities it carries out?
Sure. So Quarriers is one of Scotland's oldest charities, actually, over 150 years old. And our roots go back to the philanthropic work of William Quarrier himself, who founded the organisation in Victoria and Glasgow, ostensibly to support orphan children who were living on the streets of Glasgow at the time. And his initial endeavours were focused on supporting those children in the Glasgow area. But he soon happened upon an idea to establish a village within which he would be able to look after a larger number of children without parents, and undertook to establish a village, sourcing funding from other philanthropists across Scotland at the time. And that led to the creation of Quarriers Village. And for the best part of the 150 or so years that we've been in existence, Quarriers operated essentially as a provider of residential childcare. Initially for children who were orphaned, but latterly children who, for one reason or another, had required the support of the care system. By the 1980s, that model of care and support had really fallen out of fashion, and at that point the organisation had to diversify. And since then, the organisation has been on a journey of diversification, which has led to the development of a large number of services which we provide right across Scotland now. So actually, very few services remain in the traditional Quarriers Village. Most of the work that we do is across Scotland. And we do have a huge variety of work. So we work with children and young people in various settings, in schools. We provide youth homelessness services. We provide fostering and family support services. But we also work with adults in the social care system, principally adults with learning disabilities who we provide housing support to allow them to live independently in the community. We provide drug alcohol recovery services as well, for example. And we also provide healthcare. So unusually in Scotland, we have a hospital that is specifically designed to support people with epilepsy. And that's delivered in partnership by the NHS, so the NHS funds us to deliver that care and support. So we have a rich tapestry of services that we deliver across Scotland, across 17 local authority areas. And we have a staff group of about 1,600 people.
Thank you. Now, I want to initially look at the impact on the various groups that you support, starting with adults with learning disabilities and autism living in their own homes. Could you tell us more about the impact, the main impacts on that group, both in terms of physical and mental health?
Sure. I mean, obviously everything I'm about to say is general, and the needs of every individual that we support are specific to that person. Mm-hmm. And so the experience of every person will have been different during the pandemic. But in general terms, we have a large number of services that are designed to support people to live independently in their own homes. Sometimes they will be on their own. They will have a tenancy on their own, and we will provide occasional support. Sometimes they will live with other people within that household, and we'll provide a service to those individuals as well. So there's a variety of settings within which we operate. And the circumstances of the pandemic were often felt acutely by those individuals. Clearly, if you have a learning disability, you have an intellectual disability, and oftentimes that means that you need additional support to be able to understand changes in the world round about you. And that was certainly true of the pandemic. And it was often accompanied by a level of fear with some of the people that we supported. And our staff did a tremendous job, actually, of trying to explain why liberties were being restricted, why changes were having to be introduced to the daily lives and routines of the people we support. And that was hard because when you're supporting somebody with a learning disability, oftentimes consistency of support and routine can be extremely important. And initially, if those rhythms of the daily life were interrupted, it could be quite challenging. And that could sometimes lead to distressed behaviours. But we have a very skilled staff team, and I think one of the things that we did remarkably well is that we tried to recreate some of the certainties in people's lives that they would otherwise have connected with in the ordinary course of events. So some of our staff would recreate coffee shops within the household, or have discos and so on. And that allowed us to move through that period of lockdown in particular, to create focus and a level of normality for the people that we support. As I say, every individual will have experienced it differently. In respect of the population of adults with a learning disability that we support, some will have greater intellectual capacity than others. In some cases, we will support someone without capacity and the ability to make decisions, and that can come with its own complications as well. But we navigated through that period effectively, always drawing down on guidance from various government departments and institutions around about how best to provide care and support in those environments. Mental Welfare Commission, Care Inspectorate and so on. So we were always very aware of the importance of following the guidance that was emerging at that time. But yeah, that was the experience that we had in terms of supporting people in their own homes. Clearly, as we emerged out of lockdown, strangely enough, it created a different set of challenges for us. Because once you get into the routine of essentially staying in your own home and not really going outside, actually the routine suited a lot of people. And when that lifted, when lockdown lifted, going back to what had been normal life was in itself challenging. For some people, there was a level of apprehension. And because there wasn't always a full understanding of the virus and what it meant, that was often accompanied by anxiety as well. So that could be a slow process, and one in which we had to take care to ensure that that transition was safe and effective for the people we supported.
Thank you. Now, presumably any support that those individuals had from allied health professionals were suspended for a while. Were Quarriers staff able to carry out any of those support functions that, physiotherapists or occupational therapists and the like would have supported them with, maybe by giving instructions on exercises that could be done? Were you able to mitigate the loss of those services in any way?
So I think there's a couple of things to say about that. Firstly, we're always very careful about professional boundaries. So our support workers are are wonderful at what they do, but they're not physiotherapists, they're not nurses in the main. And even if they are qualified in that way, they are not employed to do that work. So there's a limit to how far into the territory of other professions that we can go. In the main, I think that there was good interagency working around about how support could be given. Clearly at the time, most of the conversation that we had with health professionals was in relation to those individuals that actually contracted the virus. And that was a concern. And, you know, thinking back to the early days of the pandemic, there was a lot of uncertainty and there was a lot of worry actually at that time. And yet, the staff were always focused on the well-being of the people that they supported. And I think I remember a number of the people that we support really going the extra mile, way beyond what you would ever expect in terms of a normal employer-employee relationship to support the people that they had been working with. As a case in point, I remember a colleague of ours who had a family of her own. I think she has, in fact, 6 children. And despite her own obligations, her own worries, the person that she supported took on well with COVID. She also contracted COVID and, following conversation with public health, undertook to actually live with the individual for the period that virus had been contracted, so that person had consistency in their lives, so that there was a familiar face, so that holistic care and support could be provided. And that was at her risk, you know, and obviously we risk assess the situation with public health. But there was, is an illustration, I think, of just how far people were prepared to go in the fulfilment of their duties.
Thank you. I want to move on to the support that you provide to people with learning disabilities and autism living in residential care home, which I understand includes children and adults.
That's correct.
And is that all within Quarriers care homes, or do you also provide support to people in other care homes?
No, we at the time, during the pandemic, we operated 6 residential care homes for adults with learning disabilities and other disabilities, and another residential home for children with disabilities. We also provide a number of respite services, which may or may not come on to separately, but they have a care home registration with the care inspectorate. But yeah, so we operate those care homes. I think the thing for the inquiry to note about the care homes that we operated at that time is that they stand in contrast, I think, to what we would ordinarily understand an older people's care home to be, for example. Often those care homes support 50 to 100 people at any one time. Our care homes are small. They support around about 6 individuals. It varies from home to home, but about 6 people. We have a very participative model. So the people that we support in those care homes will participate in the daily running of those care homes, the preparation of food, you know, maintaining a tidy and clean environment. And we think that that's a really good model of care and support to adopt, because it provides purpose and focus for the individuals that we support, and provides a sense of contribution on their part. And so the model, that participative model, stands in contrast, I think, to what we might ordinarily understand a care home experience to be. And one of my observations is that in trying to navigate our way through national guidance, it was often written with those kind of larger older people's care homes in mind, and not really with the sort of support arrangements we had in place in mind. So we were able to offer a highly personalised service, because the people that we support were often involved in the daily running and maintenance of those care home environments. some of the guidance around infection control was less relevant and actually harder to abide by in that context, because we didn't have domiciliary care workers ordinarily, for example. That would be a collective responsibility of the staff working with the people that we support, just to maintain the overall integrity of the care home. So that could be challenging, and I think sometimes the national guidance didn't have the nuance that was required. And the reason for that, I think, goes back in part to Care Inspectorate registrations, which are very binary. If you're registered as a care home, you're registered as a care home. And as soon as that's the case, then you have to abide by national regulation guidance and so on. And that was a stiff challenge for us to meet. We then had challenges around about the day-to-day issues that would emerge in respect of things like social distancing. Again, that could be quite difficult if you're working with a person with a learning disability. They won't always be able to maintain, for example, a 2-metre distance. Some of the people that we support were intolerant of the face masks, and particularly the more significant personal protective equipment like visors and so on. That could be distressing for some individuals, and so there would have to be an accommodation made in those circumstances. So one of the things that we did really well was work within the parameters of guidance and regulation right across the pandemic, but inevitably, if you have a person-centred focus, there has to be a recognition that the well-being of the person that you're supporting has primacy.
Yes. So does that mean that at times you interpreted the guidance in a way to allow those activities to continue? So, for example, the residents gathering in the kitchen to prepare food together or carrying out other daily activities?
We would start from the point of view that we have to acknowledge and implement the guidance. And I think, in truth, that was one of the things that we did very well across the pandemic within the organisation. But the reality of the world of care and support is that you've got a kind of a pure model, a theoretical model, which you want to try and deliver against, and then you've got the realities of people supporting people with individual behaviours and desires, and that can be the challenge. We would always risk assess. So the case in point that I was mentioning around the visor is an example where you think, well, this individual won't tolerate the support worker wearing the visor. What is the consequence if we operate without that level of protection? Is there an ability to deploy other techniques which would have the same effect, perhaps, in terms of keeping the employee safe, while not distressing the individual that we're supporting? So having that ability to risk assess in the context of the guidance was really important.
Thank you. And when it came to infection control measures such as cleaning surfaces and other things like that, is cleaning really something that usually the residents would have taken care of? And if so, during the pandemic, with the need for increased cleaning and using perhaps more abrasive substances to disinfect, is that something they were able to continue, or did you have to get more staff to aid with that?
Yeah. My memory is that model that we prefer had to be curtailed somewhat during the pandemic for obvious reasons. And my memory is that at the time that we actually had to introduce new arrangements around about domiciliary care, which we wouldn't ordinarily have deployed in ordinary times. So as I say, we would normally have a participative model where our support workers will work alongside people we support to undertake cleaning duties, cooking duties and so on. But during the teeth of the pandemic, I think we had more stringent arrangements around about infection control. So it meant that we had to adapt to a regime that was in some senses alien to us, but we understood why the guidance was written in that way. Infection control was obviously a primary responsibility for any and all organisations working in health and social care at the time, and so we took that responsibility seriously.
Thank you. Now, within the residential setting, does Quarriers provide therapies and/or education to children or young adults, or therapies to older adults as well?
So for our children, they would ordinarily go to school, and obviously that was then a challenge when the schools closed, and we did our best in that environment to maintain educational activities. Clearly, up and down the country, there were families in those circumstances trying their very best to maintain educational input, but there are limits to that. In terms of the adult population, around the learning and development that they have, much of that required in ordinary times those individuals to be supported outside of the care home environment, and again that was difficult. I mean, well, at some points during the pandemic, it was literally impossible, obviously, with lockdown measures in place. So that could be hard, and it could also, I think, elicit behaviours from some of the people that we supported, which in other times wouldn't have been an issue, because they would have been able to deploy their energies and attention to the activities that they would ordinarily be undertaking, whether that was in relation to college, whether it was leisure pursuits, whether it was going out for a drive. I mean, there was a much more stringent environment, and that's where it could be difficult, for sure.
Yeah. Are you aware of anyone sort of regressing in their abilities because the external therapies and supports stopped?
Regressing is maybe not how I would describe it. I think that some of the people that we support lack the stimulation they might otherwise have experienced in ordinary times, and that can have then an impact on mental health and well-being in particular. So, and even indeed physical health. I mean, the inability to get out as much was a factor. Some of the challenges around about maintaining family relationships could also have a profound impact on the people that we support. So I wouldn't describe it as regression, but I would absolutely agree that there was an impact as a result of the measures that had to be put in place.
We've had evidence from others in relation to, for example, physiotherapy and the support it can offer to those with respiratory conditions or other things, and that in the absence of those, of physio, for example, people had more difficulty in breathing. I take it the people you support don't have such issues, that then the lack of that kind of therapy would cause those difficulties, that then they would have to work harder to get back to where they were?
I mean, it's an interesting question, and the short answer is yes. We do have people who will have comorbidities and will have health challenges that they need to manage in their lives. Those will be challenges whether or not there's a pandemic, and will often require active management. So in the circumstances of the pandemic, it required us to adapt, to change our patterns of communication. Obviously, there was less access to healthcare professionals. At times, we had individuals who would nonetheless find themselves requiring hospital care. That was always a concern for us because, to state the obvious, if you are supporting a person in hospital, to address a particular health issue, you obviously are opening yourself to the prospect of infection from COVID-19. And that was hard. And yet, and again, this is testament to the dedication of the staff that Quarriers have and had. Oftentimes our staff would accompany them on those journeys into, through and back out of hospital again, even at risk to their own health and well-being. And you know, when you hear about colleagues who are supporting a person through that journey who then contract COVID themselves, I mean, it does leave an impact. But I think it's a demonstration of how far our staff went to maintain the health and well-being of the people that we support.
Thank you. Could you tell us about the impact of restrictions on visitation in your adult residential settings?
Mm-hmm. Well, as I mentioned, I mean, clearly it is all experienced at the level of the individual, but there is no doubt it was hard for many of the people that we support at an intellectual level sometimes to understand why these restrictions were all of a sudden in place. It was difficult in terms of maintaining those family relationships which were hugely important to them. I mean, oftentimes Quarriers will have supported a person across their adult life, and so there's a long-standing relationship there, not just with the individual but with their family. So that was really, really difficult, and when it comes to having conversations through windows or in the garden, you know, those were highly unusual times, and there's no doubt that it impacted on the health and well-being of everyone concerned, not just the people we support, but their family members and indeed staff. Because in that situation, you know, people we support could often be distressed by the lack of a normal family relationship that they were used to across their lives, and that could be difficult. We always sought to maintain a person-centred approach and to hold on to our humanity. And I remember one of my colleagues telling me about an occasion where the mother of a person that we support had died, and the brother of the person didn't want to have to tell that individual over a phone call or in an impersonal way. So we very carefully choreographed an arrangement where that was possible to happen in a socially distanced environment in one of our office spaces, where the brother of the individual was able to share that tragic news with the person that we supported, and to do that in an environment where you know, they were sitting face to face, albeit socially distanced. But it's those things that I think are hugely important. Yeah. And in the circumstances of a pandemic, clearly it's correct that decisions have to be taken around individual liberty and so on. But you need to hold on to your humanity through that period, and I think we managed that, and that's an illustration of the sort of circumstances in which you have to do that.
Thank you. And could you tell us about the impact of visitation in your children's residential setting? Was there greater flexibility there for children to see their parents or siblings, or for children to go home briefly with their parents?
Whether there was greater flexibility, I'm trying to think back to the guidance. What I do know is that that was a very difficult time for the young people that we supported in our residential unit in Quarriers Village. Because clearly, for all children, including the children that we support, there is a support network there. And that's certainly true of the people that we support, the children that we support. You know, it's not just about the support workers that provide the day-to-day care in our environment. It's the family, it's the usual school environment. It's a network of friends and peers, siblings, as you say. And there's no doubt about it that that was thrown up in the air. And I think that was extremely difficult for the young people that we supported at the time. And that would often be manifest in terms of their behaviours as well. And you could see the stress and distress that they were experiencing as a result of these changed arrangements. So yes, of course, we did everything in our power to ensure that those family relationships, peer relationships, were maintained. But there were nonetheless restrictions that we had to apply.
If there wasn't greater flexibility in relation to visitation for children, do you think there should have been? Particularly younger children, you know, I'm talking about maybe under, is it from 12 years old they start in your residential home, or is it younger as well? It
can be younger, but the children that we have in our residential unit were at the time and are older than that. But yeah, I think that the primacy of those family relationships are crucial. And I know that as we went through the pandemic, governments across the UK government, Scottish government, started to introduce family bubbles, for example. And I wonder whether more could have been made of those sorts of arrangements earlier on in the pandemic, because I think at that point you're creating a more empowering environment for people, while also recognising the importance of good public health measures. But if you can contain the level of exposure that you have to a limited number of people, then I think that there's an accommodation that perhaps could and should have been made earlier.
Thank you. Were you able to, in the residential settings, make use of remote virtual means of communication? Was that possible with the types of learning disabilities that the people you support have?
Yeah, and not just in residential settings, actually, right across the organisation. We made really good use of digital technology, in particular the dissemination of tablets across a wide variety of service and support arrangements that we have. So yes, certainly in the residential setting, but not exclusively so. And in fact, in other settings, it could be just as important, perhaps even more important. So, for example, I remember speaking to colleagues at the time. We provide an outreach service to people with epilepsy, and one of the characteristics of epilepsy is that, relative to the general population, you are more likely to be socially isolated, to have poor mental health, perhaps live on your own. So the provision of electronic means to maintain not just relationships within your own life with family members and so on, but actually with some of the support arrangements that we have in place were often crucial actually to the well-being of those individuals. So yeah, it was a really important facet of the approach to providing support that we could provide.
Thank you. Now, I want to ask you about the in the residential care setting of the impact on the work and mental health of staff, both from the increase in requirements of infection prevention and control, and also the lack of visitation. Presumably when families attend, they also carry out some work, so support the work of your staff to some extent. In the absence of that and the rise in requirements for cleaning and things, what was the impact on their work and mental health?
I think that there was a huge impact across the period of the pandemic. Again, it's not unique to residential care, but you're right to say that there were additional factors that had to be considered in that context. Changing routines and practices, particularly around infection control. I think oftentimes staff were frustrated that felt imposed, often slightly almost random at times, some of the requirements that were being asked of them by colleagues from a regulatory point of view. You know, I remember conversations about particular products being used, and so I think oftentimes staff found that frustrating, and it's that contrast, I think, that we were continually having to juggle between, on the one hand, maintaining a safe and sterile environment, and on the other hand, recognising that this is people's homes. And although when you're living in a group environment, you clearly have exposure to a virus in a way that you might not in another circumstance, we always wanted to maintain a clear line of sight to the fact that people lived in their homes, and that we had an obligation to ensure that they felt comfortable there, and that they were empowered to live as they wanted, as families up and down the country would have. So that was a balance that was undoubtedly tough for staff to manage on a daily basis. I think it is true to say that there were impacts on the health and well-being of staff. The virus, obviously, and you know, we have a big staff team across the organisation, and but we were carrying on any given day, depended on where we were in the cycle of the virus, obviously, in the pandemic. But that could be quite significant numbers of staff that we had off work because they were self-isolating or because they had contracted the virus. And the tough thing about that is it was often in those circumstances where we would have a conversation along the lines of, your colleagues just told us that they've tested positive, or that they're self-isolating. Is there any way that you can stay on and do another shift? That was a very common request. And, you know, to put ourselves in the shoes of those individuals for a moment, you know, they've got a family to go home to oftentimes. They maybe had kids that they needed to see. There's undoubtedly a recognition that when you were working in a care and support environment, you had an exposure to the virus that you wouldn't ordinarily had in other circumstances. So we were always aware that when those questions were asked, it was a big ask. But invariably, staff would respond. I mean, I think that's the thing more than anything else that was pretty humbling during that time, is that staff would always respond positively to say yes, or an accommodation could be found. And I think that contributed in a very challenging way to the health and well-being of staff. There's a psychological contract between an employer and employees, which is, here are the arrangements within which we expect you to work. And when, as an employer, you go outside of that and you start to ask for special requests, favours almost, then that can erode that psychological contract. But I think at the time people recognised that we were living in such exceptional circumstances, and because of the focus that our staff had to the health and well-being of the people that they supported, it amazes me just how frequently people said, yes, of course, I'll stay on, or I can do that next shift on the day after tomorrow, or whatever. It was remarkable. I think in the end there has been a longer term impact in terms of, it's an overused expression, but burnout, because the cumulative impact of working in that environment across the pandemic, I think, did erode the energy levels of our staff, for sure.
Yeah. Thank you. I'd like to move on to the people you support who are recovering from drug and alcohol dependency. You mentioned in your statement that it was difficult for them to source medication. Could you expand on that? Was the medication not available in pharmacies, or what was the reason?
Yeah, I mean, I guess what we remember from that time is that access to everything in life was curtailed. And I think what is true of our support arrangements for people on that recovery journey is that oftentimes there will be a lack of structure in the lives of those individuals. And so having access to the right support at the right time is crucial. And if there's a variation to that, then that can be impactful in terms of the recovery journey. So it's not that medications were withdrawn or that there was a complete absence of an ability to access those. But there's no doubt that patterns changed in terms of how we were able to provide care and support across the pandemic. And I think the other thing for that population group that changed quite radically is the level of peer support that they often relied on changed, because although they may be able to maintain a relationship with a health professional or with one of our support workers, they may not have been able to maintain relationships with other people on that recovery journey. And actually, for people in that circumstance, that can be really, really important. So I think for that population group in particular, the pandemic was really quite tough. Now, we did our very best to adapt, as we did in every service. So, for example, we have a cafe up in Elgin, which is used to really support the development and recovery of people who experience substance misuse. And we had to reimagine how that cafe could be used. So rather than that being part of the recovery process, we used it to essentially dispense food across the community. And that in itself allowed us to maintain those relationships with people we support, but actually provide a wider community benefit as well. So that's some of the ways in which we changed and adapted as a result of the pandemic.
Thank you. I do want to speak more about the peer groups, but in terms of medication, how was it provided before, and how did the provision change during the pandemic?
I would probably need to come back to you with more information on that. Essentially, there is an arrangement which is managed both through the NHS and our own services about how to maintain the health and well-being of the individuals that we support. The access to that medication, as I said, may have been provided differently, but I'm happy to come back with more particular information around about that.
Thank you. Now, in relation to the peer support groups, were they able to move online, or is this a group that's somewhat digitally excluded?
I think both of those things are true, if that doesn't sound like a contradiction in terms. So yes, we would always seek to use technology to support as best we could alternatives to our normal working practices. But it's also true to say that that population group will often be digitally excluded, may not always access digital devices, and so there were certainly challenges maintaining those arrangements for that population groups in terms of accessing peer support. Clearly, there's a temptation, isn't there, to think about the pandemic as one homogeneous block. But the reality, of course, is that our individual liberties were more expansive or less at different points in that journey. So it was certainly the case that at some points we were able to maintain something more approximate to our usual operating arrangements, but there were other times where it was extremely difficult, particularly in the hard lockdown eras.
Thank you. And then moving on to the families you support from disadvantaged neighbourhoods who struggle with their mental health, as you've set out, what were the main impacts on those people? I understand some live in small houses or flats with no garden space. How did that impact the children and their parents or carers?
The provision of family support was really quite challenging over the course of the pandemic. And to offer you a case in point, let me describe to you one of the services that we operate in Rockesia in Glasgow. It's a brilliant service which provides an early years nursery environment, but it also provides wider family support. So we're able to give structured care and support to young children, often who live in precarious environments, but we're also able to work with the parents of those individual children to provide support around their health and well-being. dealing with some quite difficult issues, oftentimes domestic violence, for example, poor mental health, suicidal ideation. So really, families that have often experienced quite a lot of trauma in their lives. And as you might imagine, in those circumstances, those children can often find themselves in vulnerable positions. And one of the great things about the support that we provide is that through the nursery, we're able to give that structure and a pathway to something that's much more positive. In the circumstances where you have the closure of the nursery, it's difficult to maintain that level of safeguarding. And so oftentimes what we would seek to do on that basis would be to develop more of an outreach model, where we would have reached out to individual family members. And we would, for example, Quarriers as an organisation during that time also did quite significant fundraising work with a view of supporting families and others who, like all of us, were experiencing life under a pandemic, but whose lives were perhaps had greater challenges than the general population. And whether it was dropping off a food parcel or a gift or something that allowed us to maintain contact, even if it was in a garden space or outside, it meant that we could essentially retain that relationship and actually just assure ourselves that some of the well-being and welfare issues that may be present in the lives of the children and within those family environments were in good order. So child protection during the pandemic was a difficult thing to get right. But I think through the ingenuity and the proactivity of our support workers, we were often able to put eyes on the children that would otherwise be in the nursery, just to make sure that they were healthy and well. And I think that contact was also hugely appreciated by the families that we support, the parents. As was implicit in your question, many of them experienced quite significant isolation. Some of them lived in a home environment where they were in a flat, it might not have had access to garden space, and that could be a pressure cooker environment. And so even a phone call was often enough just to give somebody that sense that they weren't on their own, that there was somebody prepared to listen to them, that if they needed more help or different help, then there was a pathway to that. So that was crucial, and I think many of the families that we support really appreciated our involvement in that way.
Thank you. In relation to the child welfare matters that you raised, were there ever occasions where things weren't in order, and what action did staff take then?
So we've got really robust internal processes. I think one of the things that we probably experienced during that time was a fragmentation of the normal system of support that surrounds a child in a formal sense. And particularly accessing social work input could be a tricky. I mean, in the early days of the pandemic, it felt that professionals dispersed across from their normal environments to a new way of working. Oftentimes that was remote for obvious reasons, but it meant that access to the sort of integrated, holistic discussion and decision making that would often happen around a child was much, much more difficult. You know, conference calls were really difficult to administer. I mean, really challenging, and this is, I suppose, in the early days in the pandemic in particular, when we didn't have robust or reliable video conferencing arrangements. Sometimes you would have mechanisms by which you would try and contact social work through a local authority, and you would find yourself in a labyrinth trying to find your way to the social worker that you wanted to speak to. So there were challenges there for sure. Health professionals were still present to some degree, health visitors, but again, even there, I mean, everybody's routines were changed. So the idea of having a robust and reliable network of support and advocacy around a child, I think definitely frayed during that period. All of that said, when push came to shove, where we were ever concerned about the welfare of a child, we would always make sure that that was communicated to the appropriate parties, even though it was harder. We never once, and never would, ever think that simply because something was hard to do that you then give up on that. So we would always make sure that the right people knew.
I'd like to move on to unpaid carers.
Yeah.
Do you support only adult unpaid carers, or do you also support child unpaid carers?
Yeah, we support young carers as well.
Okay. I'd like to ask you about how each of those age groups were affected. So for the child carers, presumably they were in education. What was the impact on them of managing their education, homeschooling themselves essentially, and looking after a parent or other relative?
I mean, I guess my starting point on that one is the life of a young carer is hard enough anyway, without a pandemic over the top of it. And undoubtedly there were challenges there. I think, again, it's a testament to our staff, to our support workers, that we reimagined how we can provide that support. And I remember speaking, for example, to colleagues in our carer support service up in Murray about how they would provide an outlet for some of the young carers. Maybe they would go a walk with them to ensure that they were able to spend time out of the family environment, where they could unpack the issues that they were trying to work through, whether that was around education, whether that was around their carer obligations in the home. So like anything else, we adapted and we made sure that the children and young people that we supported in that environment had an outlet and had somebody to talk to. And we would often, again, use technologies in ways which we might not have done previous to the pandemic, communication devices and so on, just to check in on people. And again, I think that helped to provide an extra layer of support.
Thank you. And of course, at certain points, respite services had stopped, and Quarriers provides respite services, but presumably those services as well had stopped. For the adult population as well, did you seek to join them for walks and for other activities that the rules permitted instead? Or?
Well, not all respite services stop, and indeed one of the things that we are very proud of as an organisation is that we provide continuity of support across all our services right across Scotland. Many of those services were inhibited in terms of the normal operating circumstances, and our respite care facilities are a case in point. So we couldn't operate at full capacity. And I think that stemmed from a recognition that in contradistinction perhaps to care home environments where these are people's homes, oftentimes within a short breaks environment, somebody will come for a defined period of time. And so there was a question, I suppose, that was discussed nationally about the necessity of that. What we undertook to do was to ensure that our respite services operated across the period, but with quite significant restrictions in terms of social distancing and numbers. So our capacity changed over that period. But we did operate precisely for the reasons that you might imagine, which is that we didn't consider this to be a nice to have. This is fundamental to the welfare and well-being of unpaid carers. To have an opportunity to have time for yourself and to be able to withdraw temporarily from your caring responsibilities is crucial. Nonetheless, it is true to say that in terms of the support arrangements available to unpaid carers across Scotland, that changed radically over the period of the pandemic. In particular, what we saw was day support services, and we don't provide any day support services, but many of the people that we support, the carers and families that we support, no longer had access to those sorts of arrangements. In a children's environment, they no longer had access to school. And in that circumstance, that could be extremely difficult. So I think it is true to say that the population of unpaid carers in Scotland had a particularly tough time during the pandemic. Now, it was tough for everyone, but I think it's fair to say that unpaid carers had a layer of responsibility and an intensity to the experience of caring for their loved ones, which would have been extremely difficult in some circumstances to manage.
And presumably even more difficult for the child carers, given their ages, of course.
Yeah, precisely. Now we tried to ensure that the individuals were well supported. I mentioned the use of technologies, oftentimes old-fashioned technologies like phone calls. I mean, just checking in on people, making sure that people were okay, exploring what we could do, drawing down on the fundraising that we had done to make sure that people had little gifts or whatever, just to make sure that they recognised or they were aware that there were people thinking about them and giving them support. So we did our best to maintain those relationships across that period.
Thank you. Do you know whether unpaid carers were able to get the medical supplies, medication, medical appointments or referrals that the people they cared for required? Was there any disruption to medical supplies?
I would need to come back to you on that. I mean, my sense is that it was a highly variable experience depending on locality, which health professionals were involved. But I don't have any specific examples that I could offer you to tell you one way or the other.
Thank you. I'd like to move on to foster carers, kinship carers and shared lives carers.
Yeah.
Firstly, could you explain what's meant by kinship carers and shared lives carers, please?
So kinship carers are members of an individual's family, a child's family, who where they don't live with their direct parents, but may live with a member of the extended family, and that person will often be remunerated to maintain those parental responsibilities, as it were. Shared lives is slightly different. That is where typically you will have an adult with who in need of support, oftentimes with a disability, who will live within a family environment, and the individuals will provide love and care for that individual, but again there will be remuneration involved for that. And foster care is obviously being similar, but for children.
Yes, thank you. Can you tell us, were new care placements able to take place throughout the pandemic, or were there periods where a new placement couldn't start because of restrictions?
The whole system slowed. I'm not aware of any formal cessation of a process, because life moves on and needs need to be met. But the whole system slowed, and there's no doubt about that. It was harder to arrange meetings, to coordinate, to have discussions, and that had an obvious impact in terms of the responsiveness of the wider social care system to people's needs. But I think it would be wrong to characterise it as completely closing down.
Were the main impacts on children and adults and carers in these situations similar to the impacts you've already discussed, or were there any particular challenges in this setting, perhaps at the start of establishing a relationship?
I think they were broadly similar. In fact, I remember having discussions with foster carers that we support, and indeed shared lives carers, about their experience and the impact of the withdrawal of key support mechanisms in the lives of the foster child or shared lives individual. And that could have really quite a profound impact on the kind of the rhythms of family life and the strains in family life and the degree of support that people had. And Oftentimes there was frustration, sometimes even anger, I think, around about an experience where, if not feeling abandoned, certainly feeling that the sort of mechanisms that were necessary to support the well-being of their loved one, the person that they supported, had radically changed and altered.
Thank you.
15 minutes, Ms. Browning.
Thank you, my lord. Now, I want to turn to the impact on young people aged 12 to 15 that you support. Firstly, why do you cover that age range?
Well, 12 to 15 was probably too specific in terms of the evidence that I've provided. We support young people in a variety of ways. There's two key areas that I suppose that are worth mentioning. One is around youth homelessness, and one is around about the work that we do in schools. And I'm really keen to speak about the latter. But in respect of youth homelessness, first of all, we will support young adults. They tend to be an older age group, actually. They tend to be the kind of 16 to 25 age group, who are transitioning out of childhood into adulthood, and for whom, in the absence of our support, may find themselves homeless. And I think there was a really tough experience for those young people. There was a very variable understanding of the restrictions that were in place across the pandemic. For some young people, they were almost oblivious. I think many of the people that we support in that circumstance have quite complex lives anyway, live with high levels of risk anyway, so the prospect of a virus out there wasn't something that would stop them necessarily from doing what they were wanting to do. By contrast, other young people in that same population group would be terrified to go out and would be isolated, sometimes at home, and tensions could emerge, particularly in group environments where young people were differently disposed towards how to manage that risk. Some young people being super cautious, others quite brazen, and that conflict could manifest itself in behaviour. So there were definitely challenges around about how we supported young people in that environment. I also did want to talk about the work that we do in schools, though, because I think one of the profound and lasting legacies of the pandemic has been around about how young people access education. And we provide a range of services across Scotland in this area. But just yesterday I was speaking with a colleague who manages our services down in Scottish Borders, and she was able to provide quite a detailed account to me of the experience that they had. They provide support to children in the school environments around about their emotional well-being and their resilience. And we had a footprint in schools for a couple of years prior to the pandemic, and so we were known and we had trusting relationships. But the speed at which they were then able to move to a digital footprint and mechanism for maintaining those relationships was remarkable. We delivered across that period 14,500 sessions with children and young people virtually. We opened up our caseload. We reduced the number of appointments where children and young people didn't turn up. And actually what we managed to achieve over that period was remarkable. The bit that we found toughest was when the schools opened up again, and yet there were still restrictions on our support workers accessing the schools because they were deemed to be non-essential staff. In hindsight, that was a mistake, because the emotional well-being of those children was absolutely the priority, or should have been the priority at that point as they made their way back into the education system. And I think as a country we probably didn't pay enough attention to that. And so, far from being a nice to have, my own colleagues in those circumstances are, to my mind, that's absolutely essential to the well-being of those individual young people. I think the other thing to say about that is that there were particular subgroups within the school age population, which were quite profoundly affected, particularly children who are neurodiverse, children who perhaps have autism, who had experienced the pandemic, perhaps counterintuitively, as a way in which they could advance their education but not having to endure school. And I use that word very deliberately because for many young people in that circumstance, school does feel like it is an experience that has to be endured. And so the drop-off that we've seen in terms of school attendance over the course of the pandemic has been quite an increase in school non-attendance. And some of the best work that we do with as an organisation now is with those school children to encourage them back into a more robust educational experience where they're more comfortable again in schools, where we're working with them in some of the mental health and wellbeing issues that they are experiencing as they reintegrate into the school environment. It's hugely important work, and I think we need to do more of it as an organisation, but also as a country, because we probably went too fast back into a mindset of educational attainment and not enough focus on the psychological well-being of the children that we support in the education setting. So we need to do more work in that. We've got some terrific examples. I mentioned Scottish Borders. We've got equally great examples in Glasgow, where we are now reaching out to those kids, to those young people, to try and reintegrate them into the school environment, and it's hugely important work.
Thank you. Now, moving on briefly to people with epilepsy, you state that you moved to an online outreach programme, but that it became difficult to pick up on the usual cues that support workers might detect in a home visit. Are you talking about cues that a seizure might be imminent, or what kind of cues are you?
Possibly, but not really.
Okay.
I mean, one of the defining characteristics of epilepsy actually is that it's often difficult to determine when seizures happen. And indeed that very fact is one of the reasons that people with epilepsy are often more socially isolated, because they can't control when, if their epilepsy is uncontrolled, when a seizure might happen. What I suppose I did mean by that is that if you have a relationship with an individual which is managed digitally, then you're confronted with a screen in front of you where you see a person's head. You don't really see much more. If by contrast you're in a support relationship which is face-to-face, you might visit somebody in their own home. You might see, for example, that they haven't been able to look after themselves. There can be other telltale signs around about in the household, which some of the skilled support workers that we have will be able to pick up on and use that to explore these in conversation with the individual about how their life is going and about some of the challenges that they might be experiencing. So in the absence of those visual cues, you're often reliant on that individual sharing with you the challenges that they're experiencing. And as we all know, not every individual is equally amenable to opening up about the experience that they're having emotionally, psychologically, and so on. So, although the development of these digital mechanisms were really crucial and far better than the absence of not having that relationship, it's not as good as face-to-face. And that's just the reality. And across all of our services that have those support arrangements, they'll tell me the same thing, that there's nothing quite like having that face-to-face relationship. Digital adds another layer, another string to your bow, but the crucial face-to-face relationship is so important.
Thank you. Now, we just have over 5 minutes left, so I want to ask you about a couple of comments you make in your statement. Firstly, at paragraph 53, you say, undoubtedly the Scottish Government got the balance wrong at times when weighing infection control measures against people's human rights. And then you say, more generally, The interests of the people we support were not always adequately considered when decisions about the response to the COVID-19 pandemic were made by the Scottish Government. However, we do accept that some decisions were having to be made within the context of a public health emergency. Could you expand on that and give examples of what you're alluding to there?
So in terms of human rights, we all have a right to a family life. And if you are living in a residential care home, you don't surrender that right when you choose to live there or when you walk through that door. Now, for understandable reasons, governments across the world, not just the Scottish Government, introduced restrictions to our liberties. We all understand the rationale behind that. But there's always a balance to be struck about other rights that people have. And that right to a family life is so fundamental that I think sometimes we got that wrong. In other words, what I would say is that oftentimes the right to a family life was experienced differently by the wider population as against those living in a care home environment. And I don't know that that always sits comfortably with me. I don't deny the difficulty of making these calls and of managing that tension. But I think sometimes the public health priority perhaps lost sight of some of those really crucial rights that people have. And I guess that's what I also mean in terms of the degree to which the Scottish Government then considered the experience of individuals in that environment. There was a lot of government investment at that time in conversations with health and social care professionals, and there was discussion, I know, about whether that balance was right. And it's always going to be difficult to answer that in the abstract. But I think there were times where we should perhaps have been more sensitive to and sympathetic to the rights of individuals to pursue that family life.
Thank you. And at paragraph 50, you say that reliance on multi-agency conference calls early in the pandemic was a suboptimal way of communicating. Conversations were difficult to follow and participate in. Do you have views on a better way of, a better system that could have been in place?
Yeah, I mean, actually, one of the things that happened quite quickly in the pandemic, certainly within our organisation, was that we became accustomed to using, in our case, Microsoft Teams. Others, Zoom was also commonly used. And that provided a structured environment within which to have a conversation, and that ranged from one-to-one conversations through to very large audiences. There are, in that circumstance, there are visual cues when somebody wants to speak, and it was altogether a more effective way of managing those conversations. The conference calls were impossible. Nobody knew who was going to be speaking when, because there was no visual mechanism there. And actually, I remember I actually came into my job right at the beginning of the pandemic. So the tail end of my last job as a Director of Health and Social Care, it was oftentimes using these multi-agency conference calls, and it was grim. I mean, it was really grim. And you often come away more confused than anything else. So, as it happens, the advancement of technologies were such that the use of Microsoft Teams was, for us as an organisation and Quarriers, crucial to our ability to manage the pandemic, to essentially effect good communication within the organisation, and to ensure that we were able to continue functioning as we did do across the period. And had the pandemic happened 10 years prior to that, when that technology didn't exist, I think it would have been a wholly different experience.
Thank you. Is there anything we've not covered today that you'd like to comment on?
No, other than to say I think it's incumbent on me to say thank you to all of the staff and volunteers at Quarriers across that period to deliver care and support without missing a beat, and to put yourself in a position where you were often exposed to more danger than you would otherwise have been. To do all of the additional work that was asked of you, in which you always rose to the occasion, I think is really quite special, and I think it's probably important for me to note in this formal environment the contribution that those individuals made.
Thank you very much.
Yes, thank you, Mr. Culley. That's
Thank
all.
you, my lord.
Right, just checking my times. 1:30. 1:30. Thank you.